Hi, Sarah.
Hi.
Hey, thanks for agreeing to tell us a little bit about your experience here at Twin Creeks Health in the Roseville Disc Center. You came in almost 2 years ago, and why don't you tell us a little bit about how you were feeling back then?
I couldn't really stand. Everything was painful, couldn't sleep. I think when I was even walked in here, I was limping, like it hurt so bad. Didn't really know what
On
it
a
was.
scale of 1 to 10, how bad was it?
15.
Okay. Yeah.
Horrible.
Yeah, horrible.
Yeah.
And so we ended up sending you out for an MRI.
Yes.
And we found that you had a huge disc herniation at L5, which is the lowest vertebrae and disc in your low back. And that was pinching or putting pressure on the sciatic nerve going down your leg.
Yeah.
Right. So, and what do you do for a living?
I'm a hairstylist.
So having that kind of thing going on must have made work pretty difficult.
Very much. I had one of those little rolly chairs, so I would sit, and then when it got painful, I would stand, and it was really frustrating.
I bet. Yeah. So we recommended a course of spinal decompression, and it took us a while to get you well because that was such a big herniation. And I think you said that it was when we started doing Softwave, which is our non-surgical.
You just got that too.
We had just gotten it, so that was almost 2 years ago.
Yeah.
So, which is a stem cell machine to stimulate stem cells. That's when you started to really begin to turn the corner.
To see a difference.
Yeah. And how'd you feel when you were on the spinal decompression machine?
Good. I feel like the first time it was, a little. I was sore, but I didn't know what I was doing. And it was still, it took time, obviously, but it worth the time, worth the money, because how I feel now versus before.
Yeah, because you're super athletic and you do a lot of things. Like you just told me, you bike ride, you
mountain bike, snowboard, wakeboard.
Yeah.
I've fallen off cliffs.
Yeah. So
I don't know where the injury came from, but one of those.
All of those probably.
Yeah, probably.
So it's fortunate you came in here rather than a surgeon, because I'm telling you, with that size of a herniation, you would have been in surgery for sure.
Yeah.
So how'd you find Chris back in our decompression and that
amazing.
Experience?
He's like the best. So friendly. I mean, all of you guys are hands down.
Right.
If I don't do hair anymore, I'm coming to work here.
Okay, good. So we try to create kind of a positive environment, and you obviously caught that.
Yeah, for sure.
So what would you tell somebody that has maybe has learned that they have a herniated disc or a bulging disc that's causing that kind of pain?
I would definitely say do this before surgery. It might take some time, but I would have paid more, done more,
Yeah,
so it's worth it. I mean,
when you use your body like you do, it's your lifestyle, right?
That was the worst in the beginning. You're like, you can't work out for 3 months. Because that's like my mental health.
I know, right? I remember that too. And you were struggling at work at that time too.
Yeah, I was trying to push through that, but I mean, it obviously doctor's orders. So.
Yeah, and how are you feeling now?
Great.
Yeah. You're doing everything again?
Everything. Yeah.
Nice.
I
Good.
go snowboarding next month. We're going to Idaho.
All right. Good. Yay. Well, thanks for sharing with us.
Of course.
We appreciate it.
Thank you.
You're welcome.